Hello, my name is Lisa Greer. I am a student at Mount Aloysius College for NU302 Health Assessment. Today I will be doing a respiratory assessment on Mrs. Smith. How are you today?
I'm fine, thank you.
Good. First, I'd like to ask you a few questions just so we can get a basic health history.
Okay.
All right. Describe your breathing today. Do you think it's different from 2 months ago?
No.
What would you say 2 years ago? Is it about the same?
Yes.
Okay. When you breathe, do you breathe through your mouth or your nose?
I breathe through my nose.
Good. Are you able to carry out all of your regular activities without a change in breathing?
Well, my breathing becomes more rapid and deeper when I'm walking at a fast pace,
Okay,
but it returns to normal once I finish my walk.
very good. When you sleep, do you lie down flat? Do you prop yourself up with pillows or do you sit up?
I sleep laying fully reclined with one pillow.
Okay, good. Do you have anyone in your family who has had a respiratory disease or problem?
No, my family does not have any problems with respiratory disease.
Good. Are you having a cough today?
No.
Good. Are you having any pain in your chest? Good. Do you smoke?
No.
Do you have a history of smoking?
Yes. No, I'm sorry, I don't. No.
Okay. Have you received any immunizations for respiratory illness this year?
Yes, I received the flu and a pneumonia vaccine just last month.
Very good. And do you suffer from any environmental allergies?
No.
Good. All right. Let me just wash my hands. So what we're going to do is I'm going to inspect your skin color and
Okay.
and I'll also just be watching your chest configuration as you breathe. So just breathe normal.
Okay.
Um, and if you get uncomfortable at any time, just let me know.
Oh, I sure will.
Okay. And your coloring is really good all throughout. I don't see any changes of color. Um, that's very good. And so just breathe normal. Excuse me. And so I'm going to be talking to you guys. While my patient has been breathing normally and I've been inspecting her color, I've been watching for her respirations and counting them while she didn't know it. That way, she's not, breathing differently than her normal. And her respirations were 14, so that's definitely normal. I've also inspected for symmetry and chest movement. And next, Mrs. Smith, I'm going to just be touching your back. I'm going to be palpating your chest and your ribs just to make sure it's symmetrical on both sides. And again, if you become uncomfortable at any time, just let me know.
Okay.
If you want to just turn a little bit to the side, that's good. Okay. And you want to take a deep breath for me? Good. What I'm looking for is symmetry as she takes a deep breath, as her ribs expand, and it definitely is normal. You can look down, bend your neck, please. Thank you. I will be palpating. Good. No pain or anything when you breathe in and out?
No.
Good. Everything feels smooth and even. I also be listening for any type of vibration. Take another deep breath for me. Good. Very good. All right. Next, I will be percussing, which is just what I want to hear is dull sounds over solid or fluid-filled areas. Mrs. Smith, you can just hold still for me. Good, very good. An unexpected finding would be hyperresonance which is heard in conditions of overinflation of the lungs or emphysema. Mrs. Smith does not have any of that, as she does not have any history of smoking. All right, Mrs. Smith, I'm going to be listening to your lungs.
Okay.
And as I do this, when you feel my stethoscope, if you could take a deep breath. And if you are feeling tired, just let me know and we can always stop.
Sure.
Let me know if you get tired.
Okay.
Now I'm going back and forth to compare each side. Very good. Everything sounds clear. You can turn around, please. When I'm listening to Mrs. Smith's lungs, a normal sound that I want to hear is I want to hear tracheal sounds, which are harsh. Bronchial sounds are loud and high-pitched. Bronchovesicular are medium and high-pitched, and vesicular sounds are soft and low. All right, next, Mrs. Smith, I am going to be palpating your anterior thorax.
Okay.
And again, I'm just making sure there's symmetry of everything, and please let me know if you're having any pain.
Okay.
As I'm doing this, I've also noted her skin color. And Mrs. Smith, take a deep breath for me. Good. And the movement in my hands was even on both sides, which is what we want to hear. Again, I'm going to listen to the front of your lungs. Okay, when you feel my stethoscope, if you could take a deep breath. Good. Great job. And just a little bit more on this side. Very good. Everything sounds clear.
Great.
Do you have any questions?
No, I don't.
Fabulous. Well, thank you again. My name is Lisa Greer for NU302, and I did a respiratory assessment on Mrs. Smith. Today I got a full health history, and that helps me determine what I could be expecting to listen for. She's not having any pain today. She's up to date with her immunizations, and her lungs sound clear. Thank you.